This is your direct and important update about the reported $1,250 SSI checks from Social Security and what this really means for seniors, disabled individuals, and low-income Americans who depend on monthly benefits. There has been a lot of discussion about higher supplemental security income payments, cost of living adjustments, and special increases, and today this complete explanation will clearly break down what is officially confirmed, who may qualify for higher monthly amounts, how these payments are calculated, and what steps recipients should take to protect their benefits. Everything will be explained in simple, clear language so that anyone can understand how SSI works and how a payment amount like $1,250 can apply in certain situations. Supplemental Security Income, commonly known as SSI, is a federal benefit program administered by the Social Security Administration. It is designed to help people who are elderly, blind, or disabled and who have limited income and limited financial resources. Unlike Social Security retirement benefits, SSI is not based on work history. It is a needs-based program funded by general federal tax revenues. This means eligibility is determined by income level, available resources, and living arrangements rather than payroll contributions. When people hear about a $1,250 SSI check, it is important to understand that the federal base SSI payment amount is set each year and can increase due to cost of living adjustments. Federal authorities officially confirm these adjustments annually. In recent years, cost of living increases have been higher than usual due to inflation. These increases raise the maximum federal benefit rate, which is the highest standard monthly amount an eligible individual can receive before adjustments for income or state supplements. The maximum federal SSI benefit for an individual is set at a fixed amount per month, and for couples it is higher. However, the actual payment a person receives depends on several factors. Some states provide additional state supplements on top of the federal SSI amount. In states that add their own supplemental payments, total monthly benefits can rise significantly above the base federal rate. When combining federal payments and state supplements, certain recipients can see totals that approach or exceed figures like $1,250 per month. Another factor that can increase SSI payments is living arrangement classification. SSI rules consider whether a person lives alone, with others, or in a medical facility. If someone lives independently and pays their own housing and food expenses, they may qualify for the full federal benefit amount. If they receive support from others, such as free housing or food, their SSI payment may be reduced. Therefore, payment amounts vary widely from person to person. In addition to the base benefit rate, cost of living adjustments play a major role in increasing monthly SSI payments. Each year, federal authorities review inflation data and determine whether benefits will rise. When inflation increases, SSI benefits typically rise as well. Over the past few years, adjustments have significantly boosted monthly payments. As a result, some recipients who previously received lower monthly amounts now receive substantially more. For individuals who qualify for both SSI and Social Security retirement or disability benefits, total combined income can reach higher levels. While SSI is reduced when other income is received, certain exclusions apply. The first portion of earned and unearned income may not count fully against SSI eligibility. Because of these exclusions, some individuals can still qualify for partial SSI payments, even if they receive other benefits. To understand how a payment like $1,250 can occur, consider the combination of federal SSI maximum benefit, state supplemental payments, and possible adjustments based on cost of living increases. In states with generous supplements, recipients who qualify for the full federal amount and meet certain living requirements can receive significantly higher totals than the federal base alone. Some states provide hundreds of dollars in additional support each month to eligible residents. Eligibility for SSI is determined primarily by income and resources. Income includes wages, Social Security benefits, pensions, unemployment payments, and support from others. Resources include cash, bank accounts, stocks, and property other than a primary residence. For an individual, countable resources must remain below a strict limit in order to qualify. These limits are enforced to ensure that SSI serves those with the greatest financial need. The application process requires detailed financial disclosure. Applicants must provide proof of income, bank balances, living arrangements, and medical status if applying due to disability. The Social Security Administration reviews documentation carefully before approving benefits. Once approved, payments are issued monthly, typically on the first day of each month unless that day falls on a weekend or holiday. Many seniors rely on SSI to cover essential expenses such as rent, utilities, groceries, and medication. For disabled adults who cannot work, SSI often represents a primary source of income. Because of rising living costs, adjustments that increase payments can provide critical relief. A payment total reaching $1,250 can make a significant difference in monthly budgeting for recipients who struggle to meet basic needs. It is also important to understand that SSI recipients are automatically eligible for Medicaid in most states. Medicaid coverage helps cover healthcare expenses, doctor visits, hospital stays, and prescription medications. This additional support increases the overall value of SSI benefits, even though Medicaid is not a direct cash payment. Some individuals mistakenly believe that a $1,250 SSI check is a one-time stimulus payment. It is important to clarify that SSI is a recurring monthly benefit, not a temporary stimulus program. While stimulus payments were issued in past years during national emergencies, SSI payments are ongoing benefits that continue as long as eligibility requirements are met. Recipients must report changes in income, living arrangements, and resources. Failure to report changes can result in overpayments. If the Social Security Administration determines that someone received more than they were eligible for, they may require repayment. Staying informed and reporting updates promptly protects recipients from financial complications. Married couples who both qualify for SSI receive a combined maximum benefit rate that differs from the individual rate. When calculating eligibility, the income and resources of both spouses are considered. This can affect total monthly payment amounts. In states with supplemental programs, married couples may receive higher combined totals than the federal base alone. Disabled adults under retirement age may qualify for SSI if they meet strict medical criteria. The disability must be expected to last at least 12 months or result in death. Medical evidence is required and approval can take time. Once approved, payments begin and may include back pay covering months between application and approval. Seniors who reach age 65 may qualify for SSI even without a disability if their income and resources are limited. For retirees with minimal Social Security retirement benefits, SSI can serve as a supplement to raise monthly income closer to a basic living standard. In some cases, the combination of retirement benefits and SSI adjustments leads to totals that approach higher figures like $1,250 per month. State supplements vary widely across the country. Some states administer their own additional payments separately, while others have the Social Security Administration distribute the supplement along with the federal amount. The size of the supplement depends on state budgets and eligibility rules. This variation explains why payment amounts differ significantly from one state to another. Inflation has increased the cost of housing, food, and utilities nationwide. Federal authorities recognize this through annual cost of living adjustments. These increases are designed to help benefits keep pace with rising prices. Over time, consistent adjustments can significantly raise monthly SSI payments compared to earlier years. It is essential for recipients to review their annual benefit notices carefully. Each year, the Social Security Administration sends an updated statement reflecting new payment amounts after cost of living adjustments. This notice explains how the new monthly figure was calculated. Understanding this document helps recipients plan their finances effectively. Individuals who believe they may qualify for higher payments due to changes in circumstances should contact Social Security to request a review. For example, if a recipient's living arrangement changes and they begin paying their own full housing costs, their benefit amount may increase. Accurate reporting ensures correct payment calculations. Some recipients also qualify for additional support programs such as supplemental nutrition assistance benefits, energy assistance, or housing subsidies. While these programs are separate from SSI, they complement monthly income and improve overall financial stability. Participation in one program does not automatically disqualify someone from SSI, but income from certain programs may affect calculations. Understanding SSI rules can feel complicated, but the core principle remains simple. SSI provides financial assistance to those with limited income and limited resources who are elderly or disabled. Payment amounts are determined by federal maximum rates, adjusted by cost of living increases, and modified by individual circumstances. For individuals hearing about $1,250 SSI checks, the key point is that this figure represents a possible total in certain situations rather than a guaranteed universal payment for all recipients. Each person's eligibility and payment amount depend on income level, state of residence, living arrangements, and other qualifying factors. Financial planning is important for SSI recipients. Because payments are modest and designed to cover basic needs, budgeting carefully ensures funds last throughout the month. Setting aside money for fixed expenses such as rent and utilities before spending on discretionary items can prevent hardship later in the month. Maintaining eligibility requires staying within resource limits. Large deposits, gifts, or inheritances may affect SSI qualification if not reported. Recipients should understand how resource rules work to avoid unintended disqualification. As cost of living adjustments continue in future years, benefit amounts may rise further depending on inflation levels. Federal authorities monitor economic conditions annually. Any officially confirmed increase will automatically apply to SSI payments without requiring recipients to reapply. The Social Security Administration continues to administer SSI payments monthly to millions of Americans. These benefits represent a financial lifeline for seniors and disabled individuals who have limited income. When payment totals reach higher amounts due to supplements and adjustments, the added support helps offset rising living costs.